Yeah, Prof. We are from Group 7 presenting to you our new business idea, Personalized AI Healthcare as part of the design thinking blockchain technology management assignments. I'm Lai here. We live in a world where the pursuit of health and well-being has become more crucial than ever before. In the midst of our busy life, staying physically and mentally fit is often quite challenging. Although the digital age brings us an abundance of health information, yet it can also lead to information overload, leading it to difficult to discern the best path forward. There is a need for a comprehensive AI-driven platform offering personalized healthcare advice, monitoring, and support providing informed decisions for healthier lives. Our interviews yield surprising insights. Physical well-being often overshadows mental health. Stress, sleep, and emotional well-being are vital. Integrating mental well-being into wellness session is also crucial. Social activities boost motivation and connections. Shared hobbies promote collective engagement. Music enhances workout and enjoyment and improve motivation. The idea, the ideal product design should prioritize user friendliness and entertainment to enhance users' engagement. Some users' concerns and priorities have also been highlighted. For example, users are generally concerned about their physical and mental well-being. Challenges like busy schedules hinder health goal achievement. User aspirations include healthier habits, sufficient sleep, exercise. Some of the barriers include lack of discipline, forgetfulness due to busy lifestyle or illnesses such as dementia, and lastly, lack of motivation. Users seek a platform to assist them in achieving well-being goals. Unmet needs reviewed in interviews demand for affordable and convenient health solutions. Personalized health guidance, monitoring for chronic diseases, continuous reminders for dementia patients, client data for trainers and insurance agents for their work, and remote patient monitoring for healthcare practitioners. We've gained valuable insights from interviews, but notable perspectives are missing. Those of fitness clients, insurance clients, and hospital patients, for example. While sharing health information could benefit coaches and agents, it also raises privacy concerns. The sharing must be consensual due to sensitive nature of health data. As such, there is importance of user consent for sharing this information. I'll now hand over to Michelle to talk about our proposed solution leveraging on technology. Michelle, please.
Thanks, Lai. This is Michelle. Addressing healthcare needs requires a multifaceted approach that combines medical, technology, and systemic solutions to ensure accessible, affordable, and high-quality healthcare for users. Using AI, we propose a healthcare assistant service that can perform a wide range of functions to enhance patient care, streamline administrative tasks, and support healthcare treatments so that the ultimate goal is to enhance the health and well-being of users. Next slide, please. We hope that our AI assistant will be able to do the following. The first, health and information and education. The healthcare assistant can provide accurate and up-to-date information on medical conditions, treatments, and medication. And this is especially useful in helping people stay up to date during periods such as COVID-19 when public health measures kept changing. Additionally, the alerts could also be provided when there are issues related to national public health concerns like dengue or hand, foot, mouth disease. Next, there's the symptom tracker, which allows people to sort of either assess their symptoms or do self-care at home. If self-care is what is sufficient, then the healthcare assistant will also provide users with home remedies and over-the-counter medication that they can take. Next, medication management. For example, if the medication they have to take makes them feel sleepy, then perhaps on that day, the user who is taking the medication can plan their day better and not partake in activities such as driving. Additionally, they might stay away from substances such as alcohol for the day. Then there's also appointment scheduling. This way, users are able to get the earliest days for their medical appointments without having to call their healthcare providers themselves. Next, we have healthcare record management, where consolidated healthcare information is available to all your various healthcare providers, which may be different. For example, you have a different chiropractor, you have a different dentist, you have a different GP, and all the other healthcare providers will be privy to the same records, thus making their healthcare easier to manage as well. Next slide, please. Next, we also have the nutrition and diet planning. A lot of people these days are looking for better nutrition and diet. These include tracking calorie intake, monitoring dietary habits, and suggesting meal plans that help users maintain their healthy lifestyle so that their healthcare journey is more consistent and sustained instead of just spontaneous. Next, we also have the fitness and exercise guidance. This will start by finding out what the fitness and exercise goals are of the user. Then from there, the AI assistant can tailor training and fitness plans to help the user attain these goals. Next, also offering mental health support. Perhaps the AI assistant can even work with online mental health platforms such as BetterHelp so that users can seek help or advice from a licensed mental health care professional. Next is also healthcare, health insurance and billing. Most of the time, this is one of the most tedious processes, and one must be able to understand financial jargon before they are able to do this task successfully. So with the help of a service that automatically links you up with an insurance and financial company, people will be better able to avoid these tedious processes but get their essential financial needs taken care of. Next, also, we can also use the health and wellness tracking. So the AI assistant should be able to monitor and analyze data from wearable devices such as fitness trackers or smartwatches, and then it can then offer insights into the overall health trends of the individual and encourage healthier habits. Next slide, please. We recommend using blockchain for this healthcare assistant because integrating blockchain technology into the healthcare assistant can offer several potential benefits. The thing about blockchain is that it is decentralized and it is very secure. So in this case, healthcare records can be secure and users can have full control over their data and only grant access to healthcare professionals as needed while maintaining their privacy. Smart contracts could also be used to control data access and consent. Next, we also have security and privacy because of the decentralized and cryptographic nature of blockchain. Data security and privacy can be enhanced, and there is a reduced risk of data breaches and unauthorized access. Next, we also have consent management, where patients can grant or revoke access to healthcare information instantly, so they have more control over their own information. Next, there's also the notion of interoperability. At the end of the day, we want the service to be applicable throughout various healthcare providers. So it's good if the service can be used across different providers, and as such, the blockchain allows interoperability because it can serve as a standard platform for sharing data securely across different various healthcare organizations. Next, billing and insurance. Billing and insurance tend to require a lot of safety and security as well because you're dealing with users' financial data. So one of the things that blockchain can help to provide using billing and insurance is security. Next slide, please. So the machine learning models that we think is necessary to develop this healthcare assistant include the natural language processing. We do want the healthcare assistant to provide human-like responses and almost be as an assistant, a human assistant to the user. So for this, it's good to have NLP models such as BERT or GPT-3 or their successors, so that these can be used to interpret user queries, provide responses, and generate human-like interactions. Next, we also want the healthcare assistant to be able to do some sort of predictive analysis, either for prevention or sometimes even for remedying. So in this case, it's good to be able to use predictive analytics, and some of the things that can be done is logistic regression, random forests, or deep learning models can be used to predict with a certain level of accuracy the diagnosis and prognosis of conditions. Giving the assistant the capability to effectively predict the right type of medication and when these can be administered as well. Next, we also would like to ensure that the service is able to sort of cluster and group the users into certain categories so that the service provided to them is more customized. So for this, we would like to use data clustering algorithms, which would help to segment patients into different risk groups or health categories. Algorithms like K-mean or hierarchical clustering can be useful, and these can be used in combination with one another so that there could be multiple clusters. Next, we would also like to think about privacy and security models, such as implementing encryption, access control, and privacy reserving techniques so that privacy can be protected. Next slide, please. The data that we predict would be required include patient health records, given that most of these information is crucial in order to diagnose somebody with their condition. Health records are crucial, and also right now chronic conditions such as diabetes, high blood pressure, and certain cancers are on the rise. Providing family healthcare records could also help in making the service more customized. Clinical data as well. Observing people's vital signs such as people's blood pressure, temperature, and heart rate could help in case an abnormality is detected, and doctors could be alerted. Electronic health records containing notes and reports from healthcare providers could also help in providing these customized service. Next, also appointment and scheduling data. At the end of the day, we want the healthcare assistant to be able to automate certain processes such as scheduling. And one of the ways that this could be done is if we have information of what are the appointments available, and then this process could be automated. Next, billing and insurance. To help customers make their payments and claim their insurance automatically, the healthcare assistant needs access to billing and healthcare information of the users.
Hi. To make the AI solution by providing health data, offering feedback on the solution's effectiveness, participating in data sharing, and potentially engaging in interviews to refine the platform further during the trial phase. Various stakeholders, including healthcare providers, fitness and wellness professionals, corporates, pharmaceutical companies, insurance agents, educational institutions, and healthcare facilities are essential partners in the solution's success. Conducting usage trials within these organizations allows for performance and accuracy testing. Gathering feedback during these trials is crucial to drive continuous improvements. Next, government agency can contribute by integrating health records into the platform, facilitating seamless data access and sharing. Smart medical devices companies can enhance the solution by integrating their device data into the platform, allowing for more comprehensive health monitoring and insights. So in summary, the success of the personalized health and wellness AI solutions relies on active engagement and collaboration with individual users, various stakeholders such as government agencies and smart medical devices companies. Conducting trials, gathering feedback, and facilitating data integrations are essential steps to ensure the solution's effective and utility. The monetization strategy for the personalized health and wellness AI solution encompasses various revenue streams and partnership opportunities. Different subscription tiers are offered to users, allowing them access to premium features and services based on their needs and preferences. This model provides a steady stream of revenue from users seeking enhanced functionalities. The solution can also be integrated into corporate wellness programs, incentivizing companies to encourage healthier workplace practices amongst employees. This not only promotes well-being, but can potentially reduce healthcare costs. Healthcare providers can use the platform for virtual consultations and remote monitoring by paying a fee for its services. These offer a revenue source whilst extending the reach of the healthcare services. Professionals in the fitness and wellness industry can receive subscription fees or commissions for clients they engage with through the platform, expanding their client base and income opportunities. We can also collaborate with medical device manufacturers, for license agreement and co-marketing efforts to boost device sales through the platform, benefiting both parties. Next. We can also look at partnerships with insurance companies, enabling the provision of tailored insurance and wellness programs to users. Earnings through commissions or licensing fees for each policyholder using the platform. Aggregated and anonymized data can also be provided to healthcare institutions, pharmaceutical companies, and research institutions for research and analysis purposes. Revenue is generated through data licensing agreements. Government health agencies can integrate their national health records into the platform with a combination of licensing and service fee for maintaining the integration. The platform offers a free version with limited features to attract users with the option to upgrade to paid subscription for more advanced functionality. So users can also make in-app purchases such as smart devices or virtual goods like premium content, avatars, thus generating additional revenue. We can also collaborate with health and wellness brands for targeted advertising and promotions, and the revenue can result from the advertising fees and affiliate marketing, leveraging the user base for mutual benefit. So next. So this business model that we presented over here is a multifaceted monetization strategy that ensures diverse range of income streams, making personalized health and wellness AI solution financially sustainable while offering valuable services to users and partners. Next, I'll hand over the time to Chi Wei.
I will be sharing some of the potential challenges during implementation of the AI solutions and our proposed strategies to overcome them. First, data security and privacy concerns. The integration of health trackers can raise concerns about the safe handling of sensitive health information, where security and privacy is of paramount importance. To overcome this challenge, we need to implement robust encryption and access controls, ensure compliance with data protection regulations like GDPR or HIPAA, depending on the jurisdiction where we will be implementing the solutions. We should also conduct regular security audits and educate staff on data privacy best practices. Next will be technological integration. Integrating various health trackers, software systems, and data sources into seamless ecosystem can be technically challenging. So we'll need to work with experienced IT professionals and healthcare technology providers to design and implement a well-integrated system. We should prioritize interoperability standards to facilitate data exchange between different platforms. Next. Ethical and legal compliance. Ensuring that the use of health trackers complies with ethical standards, informed consent, and relevant healthcare regulations can be complex. We will need to establish clear ethical guidelines and consent processes for the collection and use of personal data. Thereafter, we will need to continuously monitor and adapt practices to stay compliant with evolving legal requirements. The next one is resistance to change. Resistance to change within the healthcare organization can hinder the adoption of new technology and processes. Now, what these organizations can do is to implement a change management strategy that involves key stakeholders early in the process. Clearly communicate the benefits of the new system, address concerns, and provide ongoing support to staff during the transition. Next. Resource allocation. Implementing and maintaining a health tracker system can require significant financial and human resources. The solution will be to develop a detailed budget and resource plan. We should seek potential cost savings in other areas of the healthcare system to allocate necessary resources. We can explore partnerships or collaborations to share costs and resources. The next challenge is data governance and quality. Ensuring the accuracy and reliability of health tracker data is crucial for informed decision-making. Therefore, we will need to establish data governance protocols and quality control measures, regularly validate and calibrate health tracker devices to maintain data accuracy and to educate patients on how to use trackers correctly. Next, cultural shift. Shifting from traditional episodic care to continuous monitoring and data-driven decision-making may require a cultural shift within the healthcare organizations. They will need to foster a culture of innovation and data-driven care through leadership support, incentives, and ongoing training. Importantly, they will need to celebrate successes and share positive outcomes to motivate staff. Last but not least, regulatory changes. Healthcare regulations and standards may evolve over time, requiring ongoing adaptation of the health tracker systems. Organizations need to stay informed about regulatory changes and proactively update the system and practices to remain compliant. They can engage legal and regulatory experts to navigate changes effectively. Overcoming these challenges will require careful planning, collaborations, and a commitment to patient-centered, data-driven healthcare. So, to conclude, in the realm of the health and wellness, AI-driven tracking offers incredible potential for individuals to take control of their personal health journeys. It provides real-time insights, data-driven recommendations, and a deeper understanding of our well-being. Simultaneously, in the healthcare sector, AI-driven tracking is transforming patient care, enabling personalized treatments and improved outcomes. However, as we embrace this transformative technology, we must remain mindful of potential pitfalls. Privacy, data security, and ethical considerations are paramount. Striking the right balance between the benefits of AI-driven tracking and safeguarding personal and patient interests will be key to ensuring a healthier, more informed future. Thank you.